Hi, myself Rupinder Kaur. My student ID is 129699237. Today I'm going to perform the comprehensive health assessment on my friend. So could you please show the 360 degree angle of the room? Okay, thank you. So before proceeding, I'll do my hand hygiene. I already checked for the contact precaution. There is no need for contact precaution. We are safe. So she is my patient today. Hi, how are you?
I'm good, thank you.
Okay, so I will be your nurse today and myself Rupinder Kaur. So before proceeding, I need to check your identification. Okay, could you please tell me your name?
Navneet Kaur,
Date of birth?
April 4, 1986.
Okay, perfect. So Navneet, today I'm going to perform the full head to toe assessment on you. You are comfortable with that?
Yes.
Okay, so during the whole procedure, I'll make your privacy and dignity, and I'll keep you comfortable. Whenever you feel uncomfortable, just let me know.
Sure.
Okay. So Navneet, could you please tell me where we are right now?
Sainika campus.
Okay, what's the time?
It's 12 o'clock.
Okay, who I am?
I am my nurse today.
Okay, she's well oriented to the time, place, and person while speaking. Her communication is clear, speech is clear. There is no slurred speech present, and from her facial expression, she seems cheerful. There is no sign of anxiety. She addresses appropriate according to occasion and the weather, and her behavior and affect is the normal. So she's also sitting in the erect position. There is no hunch present in her position. Navneet, could you please walk 2 steps for me?
Sure.
Okay, as she is walking normal without any assistive devices, she don't need any assistive devices such as a crutches. She can walk by herself, and there is no stooped posture while walking. There is no sign of scoliosis and lordosis present. So Navneet, now I'm gonna proceed with the head. Can I touch your hair?
Sure.
Okay. So now I'm gonna inspect her hair for any lice, dandruff, and lesions. There is no lice, dandruff, and lesions present. Now I'm gonna palpate her head for any abnormal masses. There is no abnormal masses present in her head. So now I'm gonna check her ear. Both ears are symmetrical, and there is no drainage. And for her eyes, there is no redness in the eyes, and there is no drainage from the eyes. Now I'm gonna go do Perla. So both people are equal on both sides. Both eyes rounded and reacted to the light. The nose is symmetrical. There is no nasal deviation present. The lips are pink and the moist. There is no sign of chapped or the cracked lips. Could you please open your mouth for me? Okay, so the oral mucosa is the moist, and the pink tongue is the pink, and there is no ulcers. There is no cavity. She has a good oral hygiene. There is no foul smelling. And the oral mucous membrane is the moist, so there is no sign of dehydration. Could you please smile for me? Okay, raise your eyebrows. So facial symmetry is good. There is no facial drooping on the one side. Her smile is also symmetrical. I'm gonna check her neck for any swollen lymph nodes. So there is no tenderness in her neck. Now I'm gonna inspect her chest for any asymmetry. So her chest is symmetrical. There is no sign of the barrel chest. Could you please take a deep breath for me? Okay, so while she take a deep breath, she is in a relaxed position. There is no sign of tripod positioning. She didn't use any accessory muscles such as the tracheal duct, the nasal flare, and so that her work of breathing is the normal. I'm gonna auscultate her the lung sounds anteriorly and posteriorly. Firstly, I'm gonna do posteriorly. Could you please move to that side? Yeah. Take a deep breath. Another. Another. Okay, hold this side. Okay, so perfect. The lung sounds are clear anteriorly, posteriorly at the both apices, axillary, and the bases. There is no adventitious sounds such as crackles, ronchi, and wheezing. So now I'm gonna check her apical pulse for about 30 seconds, and the apical pulse is present on the left side at the fifth intercostal space at the mid clavicular line. Start. So her apical pulse, the rate is the 80 beats per minute, and the rhythm is regular, and the strength is strong. And now I'm gonna palpate her lungs for any asymmetrical lung expansion. Could you please lay down? Okay. Take a deep breath. Another. As my hands fall and rise at the same time, it means the lung expansion is symmetrical on the both sides. Now I'm gonna inspect her abdomen for any distension. So her abdomen looks flat, there is no sign of distension. Now I'm gonna auscultate her bowel sounds. I'll start from the right lower quadrant for any abnormal bowel sounds. So there are normoactive vowel sounds on four all quadrants, and there is no hypoactive, hyperactive, and no absent sounds are present. I'm gonna light palpate her abdomen for any tenderness, pain, and palpable masses. I'm gonna light palpate. If you feel any pain, just let me know, okay? Do you feel any pain?
No.
Okay, so on palpation there is no pain, there is no tenderness, and there is no palpable masses is seen. Now I'm gonna check her upper extremities. Could you please move your extremities up, down? Active range of motion present on both extremities. Both upper extremities are warm to touch. Capillary refill is less than 3 seconds. I'm gonna pinch for sensation. Do you feel any pain?
Yes.
There is a normal sensation present on the both extremities. Now I'm gonna check the radial pulse. The rhythm is regular, equal, bilateral, and strong, and +3 on the both sides. Now I'm gonna check her hand grip. Could you please grip my hands as much as possible? Okay, so hand strength is 5 out of 5, and the skin tone is a natural normal skin tone with the skin intact. There is no bruises and no scar present on her skin. Now I'm gonna move to the lower extremities. Could you please move your lower extremities up, down? Okay. The active range of motion is present on the lower extremities. The lower extremities are warm to touch. Capillary refill is less than 3 seconds. I'm gonna pinch. Do you feel any pain?
Yes.
Okay, sensation is present on the both lower extremities. There is no scar, no wounds present, and the skin tone is skin is intact, and the skin color is normal. Now I'm gonna check the dorsalis pedis pulse on both sides. It's equal, regular, and strong, rated +3 on the both sides. Now I'm gonna check the posterior tibial pulse. It's equal, regular, and strong, +3 on the both sides. Now I'm gonna check the dorsiflexion and the plantar flexion. Could you please move your toes towards your side, towards your nose? Dorsiflexion is strong. Could you please move your toes downward? So the dorsiflexion and plantar flexion is normal. The strength is 5 out of 5. And so this is all about the head to toe assessment. Could you please show the 360-degree angle of the room? Thank you.